Welcome back to the Student Physical Therapist Insider Access page. Today we are going to review several different exercises that you can perform using a blood pressure cuff for lumbar spine stabilization. We see in our clinic many patients that come in and they have instability or core weakness, as a lot of people say, but really it all comes down to decreased motor control, and they have decreased activation of their TRA, their internal and external obliques, and because of this decreased or poor timing of these muscles, it leads to spinal instability and low back pain. So today, Rob and I are going to review several exercises that you can do using a standard blood pressure cuff as a means of biofeedback. All right, so the key to starting, the patient's going to be laying on their back. You're going to have the blood pressure cuff underneath the middle of their low back. Lay down there. All right, when starting all these exercises, you want them to pump it up to 40 millimeters of mercury. Good. So the starting position is always 40. All right, you can see Rob's got it at 40. The first thing that we want to do here is he's going to draw in his abdominal muscles. I want him to be using mainly his TRA without holding his breath, drawing it up to 60. So go from 40 to 60, Rob. Good. And then the first way to retrain these is to hold for 5 or 10 seconds in this position. So he does a few repetitions going from 40 to 60, holding each one between 5 and 10 seconds. And then back down. Good. Do one more of those. Draw in the abdominal muscles. So as he's doing this first step, cues that I'm giving him, I don't want you holding your breath. I want you trying to draw your belly button back towards your spine to use mainly your transversus abdominis. And then also you can engage your glutes, or as I say, imagine a dog tucking his tail underneath, and it's going to draw in and force a posterior pelvic tilt. That is the first and most basic one. Generally I'll have people start here for 3 to 5 minutes, again holding for about 10 seconds per repetition. So the second progression you can do here is what I call the bent knee fallout. With this exercise, they're still going to be in the same starting position, so you start at 40 millimeters of mercury. Both knees bent up. We'll do one repetition without the blood pressure cuff working. I'm going to have you draw on the abdominal muscles as you just did. Let your left knee fall out about 50% of its way out. Good. Come back up. And then do the same thing on the right leg. And then come back up. So now what I want you to do is go from 40 to 60. Maintaining it at 60, let the left leg fall out, and then let the right leg fall out. Good, back up. Keep it at 60 here. And back up. And Rob does a really nice job with that. Things that I'm specifically looking for, and what's nice with the blood pressure cuff, is that if they have any staggering from their core pelvis area, you're going to notice that the blood pressure cuff is going to waver. And this is where you need to be really picky. If it jumps from 60 where you want it down to 56, that means that somewhere along that motion they're losing the core stability. So the first one is a basic TRA activation. We have the bent knee fallouts. Next I'm going to have you do the mini marches. So again, starting position, always start at 40. Drawing from 40 to 60. Good, and then just perform mini marches. He's lifting his foot up about 6 inches off the table, and then back down. And back down. And Rob is doing really well with this. Most of the time what you'll see is people, they will go up to 60, be able to hold that with just the activation, and then once they lift their leg off, it drops down to about 52, or it goes the other way, it'll spike up to 70 or so. So do one more repetition there. And back down. So in the clinic, patients are going to ask, why are they using the blood pressure cuff? How does this translate over to any sort of functional activity? Well, if you think about walking, basically all you're doing is lifting one leg off the ground, marching it while keeping your core stable. So if the patient comes in with a lot of low back pain, especially when they're weight bearing, when they're walking, and you can see that they have a lot of extra motion, This is essentially mimicking walking in an unloaded position. All right, 2 more we're going to do today. Just extend this leg out straight. Good. So the next progression, don't go right into this one because this one's very difficult. You're going to go from your TRA to your bend knee fallouts, mini marches. The 4th progression you can do is a straight leg raise here. So draw in, go from 40 to 60. Now Rob's going to attempt to lift his leg up to the height of the opposite knee while keeping that at 60. Really good, really good. And back down.
Physical therapy, you have a call on 601, physical therapy 601.
So one of the most difficult things about this, first of all, we're bringing the leg down, bringing him into a lumbar lordosis. So we're taking him out of that flexion, so he really has to use his abdominal muscles from the starting position. And then also raising his leg with it extended is now a long lever. So we're taking a simple exercise from before with the marches, making it much more difficult here. Really good. All right, the final one we're going to review today, I'm going to have you go into prone. I rarely get here with my patients because of how difficult this exercise is. Right underneath. So on this one, the final progression is going to be under the middle of the abdominal. I'm going to pump up the blood pressure cuff to 70 now. Good. And then on every other one, we were trying to go from 40 to 60. This time, we're going to go from 70. He's going to draw in the abdominal muscles. And then he should go down to about 60, go from 70 to 60. So, good. All right, so Rob, you want to grab onto this here? I don't know if you're going to be able to see that. All right, is that at 70?
Yep.
All right, it's at 70. Draw in your abdominal muscles. Good, and you want to bring it up to 60, okay?
Yep.
Is that 60?
It's at 60.
Okay, so again, first we would train just working from 70 to 60. You can see how drawing that in is going to decrease the amount of millimeters of mercury on there because you're taking pressure away. So drawing from 70 to 60, and then when he becomes comfortable with that, what we're going to do is just alternating prone knee bends, maintaining that 70 degrees. And then on this side as well.
Thank you. Thank you.
Yep. All right, so those are 5 different things that you can work on with lumbar extension rotation syndrome or people that have decreased core stability using a blood pressure cuff.